In the previous class of the Penicillin G, we have discussed about the chemical structure of the Penicillin G, its mechanism of action, that is inhibition of the bacterial cell wall synthesis, and why it is primarily more effective against the gram-positive organism because of the structure of the gram-positive cell wall. Now in today's class, we will discuss about the effective antimicrobial spectrum of the penicillin G, then we correlate it with the therapeutic uses and the adverse effects of penicillin G. And lastly, we will see the limitations of penicillin G. So, in the antimicrobial spectrum of the penicillin G, as we have discussed, that penicillin G is primarily effective against gram-positive organism. So first we will look at the gram-positive cocci, that is staphylococci, streptococci, pneumococci. Then it is somewhat effective against the gram-negative organism, that is Neisseria gonorrhea and Neisseria meningitidis. These are gram-negative cocci. And then effective against the gram-positive bacilli, and these are Corynebacterium diphtheria, then Clostridia, including Clostridium welchi, tetani and other species. Spirochetes, penicillin G is highly effective against the spirochetes. Spirochetes are very sensitive to penicillin G. Remember this very carefully, that even till today, that spirochetes are highly sensitive. Even minute concentrations of the penicillin G is required to kill the Treponema pallidum, then beta anthracis, then listeria. Okay, now why I have shown this staphylococci in a dark brown color? Because initially the staphylococci is sensitive, but because of the widespread use, the resistance developed to the staphylococci, and that's why staphylococci is primarily not at all sensitive to penicillin G. Same way the effectiveness, because there are many penicillin producing Neisseria gonorrhea, okay, and same way the Neisseria meningitidis. So the effective antimicrobial spectrum contains the following organisms. Now, there is one very big question that comes in everyone's minds, that why there are differences in the sensitivity pattern? Why the different microorganisms, even in these sensitive microorganisms, the sensitivity of each microorganism is not same. And the answer lies in the fact that the number of the penicillin binding proteins in each microorganism, and not only the number but also the situation, is such that penicillin not able to reach to the target site and binds with the penicillin binding protein. Okay, and then again another fact, that there is a differential affinity. Even if the penicillin binding protein is there, it is accessible, but there must be affinity. And because of these two reasons, there are differences in the sensitivity pattern. Okay. Now, you know that there are certain drugs like penicillin, then insulin, then heparin. The doses are there in the unitage. Now, why the dose of the penicillin is in the unitage? The reason is that the penicillin is primarily derived from the microorganism, that is fungi, that is Penicillium chrysogenum. Now, the method of obtaining the active principle is different, and that's why the active concentration of the penicillin is different. And that's why different method, different sources have different amount of the active ingredient. So we actually cannot quantify them. Okay, and that's why there is a concept of the unitage come. It means that we are not focused on the amount, but we are focused on the activity of the, or we can say that the actual amount of the active ingredient. Okay, and so 1 unit means 0.6 microgram of standard preparation. Okay, so if you derive penicillin from any other source but its active ingredient amount is 0.6 microgram, and if you derive the penicillin from the other source, and if the quantity differs but the active ingredient is of 0.6 microgram, then we can call it as a 1 unit. So in simple language, we want to standardize the amount of the active pharmacological component, and that's why we have standardized the dose of the penicillin in the unit. And whenever we are talking 1 unit, it means that 1 unit is equal to 0.6 microgram of standard preparation. Okay. Now in the antimicrobials, there are two things that are important to understand. One is the mechanism of action that we have seen, inhibition of bacterial cell wall synthesis, and the another is mechanism of resistance. Because within a short time I will upload a slide that is antimicrobial stewardship program. Now the biggest problem is the antimicrobial resistance, and that is here with the penicillin G also. Now the resistance is of two types. One is the natural. It means that right from the beginning the antimicrobial is not effective against a particular organism, and it is not troublesome also, because we know that this drug is not effective against this organism. But the second one, which is problematic, that is acquired. It means that initially the microorganism is responsive, but now it is not so. So now what is the mechanism of the natural resistance? Because the target enzymes and the penicillin binding proteins, they are situated deeper. Okay, and that's why they are not responsive. And in the acquired, there are multiple mechanisms, but the most important and common mechanism in case of penicillin G is production of the penicillinase or the beta-lactamase. Penicillinase is an enzyme which opens the beta-lactam ring, and you all know that beta-lactam ring is responsible for the antimicrobial activity. And the bacteria elaborates this enzyme, and that's why the penicillin becomes ineffective. Okay. Now in case of gram positive, it is an inducible. It means that the gram positive organism induces the synthesis of the penicillin, while in case of the gram negative, they are constitutively present. Okay. Now we will see the pharmacokinetic characteristics of penicillin G. Penicillin G is orally effective, that is fine, but it is highly gastric acid labile. So only 1/3 portion of the penicillin G, it actually reaches to the systemic circulation. Second is its distribution. It is only extracellularly distributed. It cannot enter into the cell, and again it cannot crosses various barriers like the blood-brain barrier. Its CSF concentration is very less. And penicillin G is primarily eliminated unchanged by the kidney. So forget about the hepatic metabolism. And again in the kidney, there are two processes for the elimination. One is the glomerulofiltration and second is the active tubular secretion. Now penicillin G is eliminated by the kidney through the process of active distal tubular secretion, and this is blocked with the help of the proben acid, and that's why we can use the proben acid to prolong the action of penicillin G, because penicillin G is having a shorter duration of action. Okay. Now different preparations of penicillin. Okay, as we are told that the natural penicillin G, that is sodium penicillin G, it is also known as a crystalline penicillin, and its dose is 0.5 to 5 mega unit, and it has to be given every 6 hourly or 12 hourly. Now I have told in my previous slide one limitation of the penicillin G is its shorter duration of action, and this can be overcome by adding some impurities, and that's why the penicillin is deposited over in a local site at the site of the intramuscular injection administration, and from there the penicillin released slowly, and these type of the preparations are known as the repository preparations of penicillin. And the first and the foremost is procaine penicillin. Procaine is added to slow the release of the penicillin, and because of this we can somewhat prolong its duration of action, and the dose is 0.5 to 1 mega unit 12 to 24 hourly. Okay, but the another preparation, that is fortified procaine penicillin. Why this has been prepared? Because once you are adding the impurity, the release of the penicillin gradually decreases, and that's why you will not get the immediate release. So that's why it is not helpful for the immediate action. But if you combine this procaine penicillin with the penicillin G, then you can achieve the both the immediate onset as well as the relatively longer duration of action. And that's why this fortified procaine penicillin, which is a mixture of 1 lakh unit of sodium penicillin and 3 lakh unit of procaine penicillin, that has been formed. Then the longest acting penicillin preparation, that is benzathine penicillin, and it is having a very slow release, and that's why it is having nearly a peakless effect, and one can find the release of the insulin up to 4 weeks. Okay, and that's why it can be administered as a 0.6 to 2.4 mega unit every 2 to 4 weekly. So these are all about the penicillin preparations. Okay, now the adverse drug reactions. In my first slides I have told that the penicillin, which was the first antibiotic of the chance discovery, and it is the safest antimicrobial, it is true. There are two major adverse reactions. One is the local irritant effect, that is not that much serious. Okay, and in the local reaction, if you are administering orally, because of the irritant in nature, nausea and the vomiting. If through the intramuscular injection, pain at the site, and IV injection, thrombophlebitis. But the second reaction, that is hypersensitivity reaction, that causes a problem. And you all know that hypersensitivity is a range of the reaction. It starts with the minor redness, itching, rashes, up to the gradually angioneurotic edema sickness, and up to the anaphylactic shock. Okay, and because of these unpredictable, this is an unpredictable adverse reaction, it is also known as the type B adverse drug reaction. Although this adverse drug reaction with the penicillin G, it is in less than 1 in 10,000 people, but if it occurs, it can be life threatening, and because of this now the use of the penicillin G is limited. So I am not telling the two contradictory statements. It's very true that penicillin G is the safest antimicrobial, but in one individual out of the 10,000, if the anaphylactic shock occurs, then it is life threatening. Okay, now something more about the hypersensitivity with the penicillin G. What is the pattern, how we can prevent it, and all that. It is seen in around 1 to 10% of the individual. It is more commonly seen with the parenteral preparation as compared to the oral, and it is highest with the procaine penicillin, because procaine itself is an antigenic, it is highly allergic in nature, and that's why the antigenicity and the hypersensitivity reaction is maximum with the procaine penicillin. And yes, this is a very important point. There is a cross sensitivity, because here we are talking only about the penicillin G, but later on there are various semi-synthetic penicillins, then other beta-lactam antibiotics like cephalosporins. So if there is a hypersensitivity reaction with any of the penicillin preparation, there are chances of a cross sensitivity, and that's why one has to avoid use of any other beta lactam antibiotics. Okay, now how we can prevent, because just there is the occurrence of the hypersensitivity reaction, we cannot omit the penicillin from the usage. Okay, first and foremost is the history of the penicillin allergy. Before prescribing the penicillin, ask the patients whether you are allergic to any of the drug, and if the patient says yes, then you dig out something more from the patients. Most common allergic reactions are with the sulfa drugs, then penicillin, then NSAIDs. So you have to dig out. But suppose patients are not knowing, then, and if you find that it is the most required agent in a particular condition, then you can do the scratch test, which is also known as an intradermal test, a minute quantity of penicillin, that is penicillin G 2 to 10 international unit, which is injected intradermally into the forearm, and you can see for the reaction after the 30 minutes. If there is any redness or edema or blistering occurs in that or that local area, it means that the person is sensitive to penicillin G, and you must not use this penicillin. But many a times what will happen, that if the person is so much sensitive to the penicillin G, and even if you are giving this test dose, but then again the patient develops anaphylactic shock, and to prevent this we can give another penicillin which is not antigenic, and that is benzyl penicilloyl polylysine. Okay, and because of this hypersensitivity reaction, even though the penicillin G is effective topically, its topical use is absolutely contraindicated. Okay, and as I have told you that penicillin is very effective against the spirochetes, that is Trichoderma pallidum, which is responsible for the syphilis, and it is the drug of choice, that is fine. But the person is having syphilitic lesion, and if you are giving the penicillin, initially you can see that the lesions are increasing, the fever is increases, there is rigors, and you may feel that rather than improvement in the condition deteriorates. But no, it is actually not so. It means that the penicillin starts acting, the microorganisms are killing, and because of this the release of this spirochetes lytic products, the reactions are there. It is a self-limiting condition. At the most you can give some antipyretics and all that to prevent these allergic reactions, and these reaction is known as an Herxheimer reaction. Okay, now the therapeutic uses of the penicillin G in any antimicrobial. This is the first antimicrobial we are discussing, but in every antimicrobial you have to correlate the therapeutic uses with the effective antimicrobial spectrum. So, which is the effective antimicrobial spectrum? Streptococci, pneumococci, Corynebacterium diphtheria, Clostridia, spirochetes, beta anthracis. So, streptococci. So, which are the streptococcal infection? Otitis media, pharyngitis, rheumatic fever. So, these are the therapeutic uses. Then pneumococcal infection, lobar pneumonia and meningitis. Corynebacterium diphtheria. Why I have shown in a green color? Because it is very effective. Till now there is no resistance, and along with the anti-diphtheric serum, penicillin G is the drug of choice. Same way with the Clostridium. Tetani will lead to the tetanus, and Welchi will lead to the gas gangrene. And along with the anti-tetanus serum, penicillin G is the drug of choice. Spirochetes very effective, and there are different stages of the syphilis. There is latent syphilis, primary syphilis, secondary, tertiary syphilis, gabata syphilis, and the doses are different. Okay, that you can find through the textbooks also. But for the syphilis, till today the penicillin is the drug of choice. And anthrax. So in all these four conditions, diphtheria, tetanus, gas gangrene, syphilis, anthrax, the penicillin G is the drug of choice. Now there are certain prophylactic uses. of the penicillin G, and that is rheumatic fever. Okay, for the prophylaxis of the rheumatic fever, because these enterococci they can colonize on the cardiac valves, and they will lead to this progression of this rheumatic fever. And for the prophylaxis we are using the benzathine penicillin, because it is the longest acting penicillin. We require a minute, even though the minute plasma concentration for a very longer period of the time, and that's why benzathine penicillin, it is used in the dose of 0.6 to 2.4 mega unit every monthly till the 18 years of age or 5 years after the last attack, whichever is longer. And second is the subacute bacterial endocarditis. It means that when the person is already having a valvular defects, okay, and in that case the chances of the deposition and the colonization of the streptococci on the cardiac valve is very high. And if the person is having bacterial infection, and if that person has to undergo the tooth extraction or endoscopy or catheterization, then for the prevention of subacute bacterial endocarditis, one has to give this benzathine penicillin. So these are the two prophylactic uses of penicillin G. One is for the prevention of the rheumatic fever, and second is for the prevention of subacute bacterial endocarditis. Okay, I have already told in my lecture of the chemoprophylaxis that rampant use of the antimicrobial just for the sake of the safety, one must not use for the prophylactic purpose. But there are certain conditions in which there are definite chances of development of serious infection. In that case, you must have to use the antimicrobial. And these are the two rational indications for the use of the antimicrobial for prophylactic conditions. Now in nutshell, what are the limitations of penicillin G? First and foremost, that it is an acid labile, so its oral efficacy is very poor. Second is susceptible to penicillinase, that is the biggest problem. Third is, you can see its spectrum. Even against the gram positive, it is not effective against the staphylococci. Forget about the Enterobacteriaceae group, gram negative bacilli, not at all effective. So it is having a very limited spectrum of action. And lastly, I have shown in the red hypersensitivity reaction, because this limitation is such that it will seen with the each and every penicillin preparation and it cannot be overcome. Okay, so that's why there are three major limitations, and these limitations can be overcome by the semi-synthetic penicillins, and that's why there is a development of semi-synthetic penicillin, and these are poor oral efficacy. It can be dealt with the help of the acid resistant penicillin, susceptibility to penicillinase. So now just look at this story, which is very interesting. Initially we serendipity we come up with an antibiotic, that is penicillin. Then the organism, what they do, organism find out, okay, this is the beta lactam ring and that is responsible for its antimicrobial action. So they find out one enzyme and that opens the beta lactam ring. So they produce penicillinase. Now we come up with a drug or a penicillin product which is highly resistant to the penicillinase, which is produced by the microorganism. So these are penicillinase resistant penicillin. Okay, then the story lasts long, but that I will tell you in subsequent classes. Then the next limitation is narrow spectrum of action. This can be overcome by the extended spectrum penicillin. Okay, so in the next class we will discuss about in details about the semi-synthetic penicillins. Please give your feedback in the form of the comments in the comment section. Feel free to write, And if yet you have not subscribed to this channel, that is Pharmacology in Simplified Way by Dr. Darshan Dave, please subscribe it. And if you really find this lecture helpful, please like it. Thank you very much.